packed day, so we'll start. I want to welcome you back to day 3. I hope that you brought back a lot of energy and enthusiasm. We've just passed the halfway mark of Asia Pacific Social Protection Week, and I think it's going to be another very interesting day. My name is Wendy Walker, in case I haven't met some of you. I'm the chief of the Social Development Thematic Group here at ADB, and it's this team, the Social Development Group, that has put together this week and are hosting it. So we're going to start today with a broad, with the keynote, which is going to focus on Social Security for Asia and the Pacific. And this keynote, which is focusing on the 10 challenges for Social Security, is really going to help to set the scene, as we've tried to set the scene every day, for the range of sessions which will happen afterwards. The 2 immediate sessions after this are going to be breakout, so they're on either side of the room today. The first one is on closing the Social Security gap, and the second one will be on developing social pensions in Myanmar, Thailand, and Timor-Leste. So it's going to be a very fast and interesting day, and I'm very pleased to introduce our keynote speaker, Ms. Maribel Ortiz, who is a senior specialist in governance at the International Social Security Association. She is an economist by profession, and she joined the International Social Security Association in 2005. First as the regional director for Asia and Pacific, and currently as the senior specialist in governance. She led the development of the ISSA guidelines on good governance, which led to the launching of subsequent sets of ISSA guidelines on other strategic areas and Social Security administration. Dr. Ortiz has a PhD in economics from the University of Pennsylvania. So we're very pleased to welcome her here today. She flew in all the way from Geneva. Before her presentation, we're going to show a short video of a couple of minutes which gives the overview of the 10 key challenges, and then she'll take us through a deeper discussion. And afterwards, we'll save a few minutes for questions from the audience. So thank you.
Good morning, everyone, and I'm very happy to be here. Thank you, Wendy, for having me here. I thought it was best to start this morning's session with that 2-minute video mainly because it is able to say in 2 minutes flat what I will try to expound on and try to summarize in the next 20 minutes or so. Now, this session is really more like an introduction to the parallel sessions that will be following today and the rest of the week, although I understand that there have already been discussions on such topics as child benefits, gender issues that surround Social Security, health care, the new forms of employment, and the challenges that they bring. And so maybe I can just take off from there or continue from there. Okay, let me see how this works. I think you have the wrong presentation. It's the one on global challenges. Anyway, the 10 global challenges for Social Security in Asia and Pacific is based on feedback from ESA member organizations from the region. And you can download the report from the ESA website. Just go to www.esa.int. And I would also encourage you to download the other regional reports from the Americas, from Africa, and from Europe, because it's quite interesting to see how the different regions rank their priorities in terms of the Social Security challenges. There are similarities, there are differences in how they rank these challenges, but there are also similarities and differences in the responses and the innovative solutions that the regions are pursuing to respond to these challenges. Okay, so the topmost priority challenge is really closing the coverage gap. And as you are probably familiar with the numbers, they show that there's still a lot of work that remains to be done, but definitely progress is being achieved. There are now more than half of older persons that have coverage in the Asia-Pacific region, compared to a decade ago when all that we could say was that less than half had this coverage. So from less than half, we now have more than half. And I recall that in 2008, China had about 23% coverage for pensions for older people. But in the span of 9 years, by 2017, they were able to achieve universal coverage for pensions. So considering the size of the population of China, this must also be part of the reason why the needle has moved up a bit in terms of coverage for older persons in the Asia-Pacific region. And of course, we have universal social protection being introduced by many countries in the region. So this combination of non-contributory and contributory programs is also helping move up the needle towards coverage. Extension is actually a top priority for all members of the region, but most especially in Africa, where, if I recall correctly, 85% of our members were saying this was their topmost, or this is their topmost priority. Now, how is the region closing the coverage gap? There are many innovations. There are legislative amendments being introduced because most legislation do not really include self-employed and informal sector workers, and now amendments are being introduced to open wider the mandates of Social Security organizations. Innovations in program design, they are trying to reach out to the informal sector workers, to rural workers, etc., because I think more than 68% of the labor force in the Asia-Pacific region are in the informal sector markets. New legislations are also being introduced. For instance, in Malaysia, they recently introduced the Self-Employed Social Security Law, where platform service providers are regarded as employers of platform workers, the Uber drivers and similar types of services, and therefore are obligated to contribute to for the Social Security coverage of those platform workers. Of course, there are differences, because in Uruguay, for instance, they see platform workers more as self-employed workers and are therefore responsible for their own Social Security coverage. So between this difference that you are an employee or you are a self-employed, there is this disparity. But what I am seeing and what I think is important is that, number one, there's of course an issue of clarifying exactly what the status of employment is for these gig economy workers and platform workers. But given that this might take some time to clarify, the thing is there is a solution. Malaysia, which regards platform workers as employees, and Uruguay, which regards platform workers as self-employed workers, both have found a solution to cover them through technology. There is a platform that does the registration, the remittance of contribution, that facilitates everything, regardless of how you are treated, whether you're an employee or whether you are a self-employed person. Okay, Indonesia, BPJS Kesehatan, for example, and the SSS Philippines. These are some of the examples that I can think of that are really working actively with community associations, with informal sector groups to extend coverage in the informal sector. And there are also advantages there are also innovations that are taking advantage of ICT advances, like the remittance of contributions through SMS. In Africa, Kenya is a lead. Kenya, Tanzania, these are the two countries that are able to extend coverage, not by having a face-to-face encounter, but really through SMS and mobile technology. They're also equipping inspectors with tablets and applications so that on the spot they can do the registration of workers in the informal sector. Okay, so this is now our slide. Okay, the second challenge that has been ranked by the Asia-Pacific region is health and long-term care. And the numbers show that healthcare is regarded as one of the most expensive, with high out-of-pocket expenses, but having no health care, of course, is absolutely the most expensive kind of thing that can happen. NCDs, non-communicable diseases, are a serious concern. Cardiovascular diseases, diabetes, and cancer. Tuberculosis continues to be a menace in the region. We know that the health infrastructure in many countries is quite constrained. There is a brain drain of medical professionals, and long-term care is also a looming concern for the region. Okay. Now, how is the region meeting the challenge? Well, supporting primary care, preventive, proactive, and community-based participation. This is among the responses, the innovative responses in the region. Technology is also being used to reduce barriers to access health care. M-Health applications, e-prescriptions, for example, in Singapore. And then in China, in Bangladesh, in India, doctors and health professionals are being linked to remote areas to serve the health needs of the people there. And as far as the looming long-term care crisis, currently only Japan, Singapore, and the Republic of Korea actually have established long-term care measures. And it's not a problem for Asia Pacific. It's not a challenge for Asia Pacific only. It's a challenge for all regions. In Europe, for example, there are still only a few countries that have universal coverage for long-term care. For instance, Belgium, Denmark, Germany, and the Netherlands are among these few countries. But most countries are exerting efforts toward home-based and community-based long-term care, and the idea is to reduce the use of healthcare tertiary facilities, which are more expensive, and freeing up the tertiary facilities for those who are really sick and who are really in need, and then trying to provide home care or community-based care to those who need long-term care. China, again, is an example. They are piloting online nursing services to provide visits to patients who have just checked out of the hospital for the follow-up care. A third challenge is the technological transition. And the good news, and this is good news, is that the absence of physical infrastructure no longer deters Social Security services. Excuse me. Because now, the mobile technologies, electronic platforms, and the Internet of Things are providing a virtual structure to extend coverage and to provide Social Security services. And this can be seen from the increasing access to technologies and the widespread use of technologies in the Asia-Pacific region. So, what are the things that are being done in this area? Well, there can be no denying that ICT is a strategic enabler. Smart cards, electronic IDs, biometrics, the Internet of Things are empowering users. There is really this trend for all Social Security administrators to go electronic, go mobile, go online, and to take advantage of the technological transition. Big data, artificial intelligence are supporting data-driven analysis and policy making. For instance, the Department of Human Services in Australia is fighting error, evasion, and fraud with big data and analytics. Artificial intelligence is also being used to service the needs of some customers. For instance, in Saudi Arabia, the General Office of Social Insurance, GOSI, is using chatbots. They are piloting the use of chatbots. This is really just you, when you log on to the website, there is this virtual assistant that tries to answer your questions on a 24/7 basis. The interoperability of systems is enabling one-stop shops and bringing Social Security administration into the ecosystem of e-government. The Republic of Korea, for instance, the 3 Social Security organizations that are administering 4 programs in the country have managed to put together their databases so that their one-stop shop is a real one-stop shop that serves not just one Social Security program, but all 4 Social Security programs. In other words, any citizen can step in and can ask any question about his or her coverage in terms of those 4 Social Security programs. And I was really very recently surprised by Vietnam Social Security. As you know, Vietnam Social Security is one of the youngest Social Security organizations in the region, but already they are looking into e-government, and my understanding is VSS is one of 6 government agencies that are working together to try to put this common database in order to serve not just Social Security, but all public services to be provided to the citizens. The flip side of this, of course, about taking advantage of the technological transition is that there are many issues related to data privacy, data security, and data protection. There are issues surrounding the ethical use of big data and artificial intelligence. There are risks of algorithmic biases. There are risks of misuse or unintended consequences. And there are risks of creating a digital divide because there are still huge segments of the public that we would call non-techies, and I would be one of them. There are non-techies and there are techies who are so, they're so adept, they're so technologically agile about these things, but the idea is, sure, you take advantage of the technological transition, but do not leave behind those people who are not quite as adept in using these kinds of things. Okay. The fourth priority challenge is meeting public expectations. Public expectations and public trust, there is no other relationship that is more direct as this. If the public, if government or Social Security administrations do not meet public expectations, then you also lose public trust. And in this age of social media and mobile technology, wrongdoing or bad service, regardless of whether it is fact or fiction, can easily go viral. And when these bad news go viral, they do damage the reputation of the institution. That is why there is more pressure on Social Security administrators to really get their acts together and meet public expectations. So how are they doing this? I'm sorry. Okay. I'm trying to go back to the previous slide. Yes. How are they meeting the challenge of meeting public expectations? They're putting clients at the center stage. This idea of a one-size-fits-all is a thing of the past. Now it's like providing tailored services, customer-centric services, where you try to anticipate the needs of the clients even before they think about it. There is a trend to go electronic, go mobile, and go online, as I mentioned earlier. And the idea is to be proactive and not reactive in providing Social Security services. And in the region, Singapore, for instance, and Malaysia, they do not wait for the retirees to come in and submit their retirement claims. They anticipate, and they are the ones who go out and invite the person who's about to retire to come in, or it is the CPFB or EPF Malaysia that goes to the residence of the client, of the member, and goes through this communication, orienting them about what to anticipate, etc. An interesting example, again, another interesting example is what Kela in Finland is doing, because communication is very important to meet public expectations. They have new ways of communicating by asking provocative questions. It's just to alert the public that there are these services, there are these benefits that Kela is providing. For instance, when they are trying to address or attract the middle-aged group, they ask a question like, does someone in your family have memory loss? So it's not like a direct sell, like, please come in and talk to us about family memory loss, but they ask it in such a way that if you are surfing and you see this question right away, it grabs your attention. Or when they're trying to address the millennials, they ask questions like, are you having problems planning your future? Or is your summer job taking away something from your educational grant? So very direct questions that people can easily respond to and say, oh yeah, I need to get in touch with my organization and see what's going on. Okay, the next is, the fifth priority challenge is population aging. And as these numbers show, Okay, it is a reality in the Asia-Pacific region. Japan is already experiencing it. Vietnam, Thailand, and China, of course, are on the way to this challenge. And the question is, how is the region meeting the challenge? Well, extend pension, health, and long-term care coverage, balancing sustainability and adequacy. Now, I have more to say about this later on in our session on extending coverage, because when you talk about coverage, it's not just the numbers of people that are covered by the program or the numbers or types of contingencies that you are covered for, but it's also the depth, the level of, or the adequacy of protection, the adequacy of coverage that you are receiving. And we have a tendency to look at this problem as it's a policy dilemma if you look at it only from the point of view of a program, because we say that, okay, when you increase the level of benefits, then you would expect that the actuarial life of the fund is going to be affected. But perhaps if we step back a little bit and use a wider lens in looking at this problem of providing adequate benefits, then we can make progress and innovate on this problem. Supporting activity and employment in old age is also one of the ways through which the region is meeting the challenge. Investing in education, prevention, and active aging is also another response to the challenge. Now, the labor markets and the digital economy, I think there has been some discussion on this already in the previous days. The challenge of the digital economy is already upon us, and there is wide anticipation as to how this digital economy is going to affect us. On the one hand, it is anticipated that low-skilled, routine kinds of work will be replaced by robots, will be automated. But freelance workers are now, in fact, finding work in the gig economy. I was also impressed by an experience shared by Malaysia, where they said that now people who are hard of hearing or who are deaf and people who cannot speak or are mute are able to become Uber drivers, because in Uber you don't need to speak or talk or listen to your passenger. All you need to do is to drive him or her to where he is going. So these people are now finding employment. So the question is, okay, what is going to be the balance? And this is, I guess, something that we will just have to look at and anticipate in the next coming years. But ILO and the World Bank both agree that the critical step to confront this challenge with is through training. Anticipate the gaps that will come out, the gaps that will appear, and to try to close the gaps through skills and education. And I also find the perspective of the Institute for the Future of Work, where they say, we are very concerned about the challenge of automation and how automation is going to displace workers in the labor market. But maybe the question, instead of asking the question, will robots or how will robots replace workers, the question should be turned around and ask, and instead we ask the question, how can we make robots complement the work of humans so that humans will become more productive, more innovative, and better oriented towards this digital economy. And of course, from the point of view of Social Security, the question is, how will this impact Social Security? And as I relayed to you, the critical issue here is determining the status of employment of the workers in the gig economy, in the digital economy. But again, regardless of whether you consider them as employees or as self-employed or somewhere in between, the technology exists in order for these people to be covered in order for these people to be registered and to remit their contributions. I'm reminded of one of the things that the Social Security system of the Philippines is doing to cover informal sector workers. Because of the irregularity of their incomes, they are not able to come up with this one-time payment of their monthly contributions. They came up with this idea of having coin banks where tricycle drivers, workers in the agricultural sector literally put or drop coins into this coin bank until such time that within the month they're able to accumulate the monthly contribution, and then it is taken by the Social Security organization. So virtually that can also be done, that perhaps it can be accumulated this way so that at the end of the month they're able to come up with the monthly contribution. So I think I'll stop here so I can take a few questions, and then we can move on and go into a more intensive discussion of how the coverage gap can be closed in Social Security in the region. Thank you.
So thank you very much, Ms. Ortiz, for an excellent overview of many of the issues, which also connect us to the discussions we've had in the last couple of days and help us to enter into the discussions for today. I'd like to, I think our question technology is not working yet this morning. So if there are any questions in the old-fashioned way, we'll go old school and ask anybody to raise your hands from the audience. We can take a couple of questions directly for Ms. Ortiz. She will also be in the next session as well on expanding Social Security. Just an anticipation, though, I do see two. So the first one is ICT is an enabling instrument for inclusive social protection. However, availability, affordability, and technological gaps may create barriers for the poor. How can we ensure that the poor are not excluded?
Yeah, thank you for that question. The thing is, the mobile phone is a ubiquitous instrument. Everybody has this, regardless of whether in which part of the continuum you are in terms of the income scale. So once you have that instrument, you have access. And for instance, in India, this Aadhaar identity card that they have, and it's for everyone in India, it's not just for identification. It's actually a way of linking. Once you have your Aadhaar card, it's a way of linking to public assistance, to access social assistance, to access banking facilities, etc. So I think technology is actually an enabler for the poor to access Social Security services. And Social Security organizations, administrators are very aware of this, and that's why I was mentioning earlier that there should be no digital divide. But then when you talk about the mobile phone, everybody understands how to use the mobile phone. So I think it's really a very effective instrument. In Kenya, in Tanzania, this is how informal sector workers are able to register, are able to remit their contributions to Social Security, their Social Security contributions. So I would think that it's really more an enabler, and it is the responsibility of the administrator to become creative, to become imaginative as to how technology will become an enabler for everybody, including the poor.
Thank you. Anything from the floor? Okay. Not enough coffee yet? Oh, there's one question back there.
Good morning. Michiel van der Rauwera from ADB. In your first challenge on the closing of the coverage gap, you talk about the combination of contributory and non-contributory schemes. You present the agencies that usually do the contributory schemes, and you cover most of the time smaller groups of the population. So in reality, how do you see it, this complementary between contributory and non-contributory schemes? Because often it's different agencies, different ministries.
Absolutely.
How does that work in practice?
Yes, I think this is what the ILO is promoting. I think it's part of this multi-pillar approach in providing for social security. Like you need a basic floor of protection, and this is usually the way that is being done now. It's usually being administered by the government because it's tax funded. And then as the population becomes more, starts earning income and they qualify and are able to contribute to the contributory program, then they get up on the social security ladder. So I think this is how it is being done. The agencies that administer are quite different because the contributory programs have their own monies, have their own funds, and as governance, the good governance principles will tell you, there should be no mixture of funds in such a way that some program is piggybacking on the resources of another program. So I think there should be a clear division as to how non-contributory programs are administered, how they are financed, what are their resources, and that should be kind of separate from how the contributory programs are being administered.
Thank you.
Thank you.
And maybe just one final one, this one that just popped up, asking about will there be shifts in benefits and systems with the gig economy? Will it result in more social assistance than pension systems, given the gig economy, where it is hard to establish contributory schemes?
Mm-hmm.
So do you anticipate any important shifts that will take place?
Oh, this is not a very easy question to answer. I think it's a question of the decade that we are trying to answer. How is it going to impact on Social Security? But again, I would step back and look at the architecture, the Social Security architecture of a country. What is there? Okay, what is out there? If you have a social protection floor, if you have contributory programs, and then you have the voluntary programs where you provide for additional protection for yourself, then I see it as the gig economy worker. What are the rights of the gig economy worker with this backdrop of Social Security architecture to work with? And that's why it's very important to define what are the rights of gig economy platform workers in terms of Social Security. And I think it's still a huge point of debate whether they're considered as self-employed, whether considered as employees, or how are they related, what is the responsibility of the platform provider vis-a-vis the platform worker.
Okay, well, thank you very much for taking us through at least the first half of the challenges. The rest of the presentation is available on the app, and it's a very interesting presentation, so I encourage you to download and look at the other 5 challenges. And thank you for taking us through that global and regional view, and also about the approaches the different countries are taking to trying to achieve them. With that, thank you very much, Dr. Ortiz. Can we give her a round of applause?
Thank you very much. My pleasure.
And now we can break up into 2 sessions. As I said, one on social pensions over here and one on broader Social Security over on the right, where Dr. Ortiz will also be presenting. Thank you.